Hello folks, I welcome you all again for this presentation today. So as you all know, I'm Dr. Kapil R, currently working as a lecturer in the Department of Prosthodontics, Sri Ramchandra Faculty of Dental Sciences. Here in front of you to discuss on the topic periodontal considerations in fixed partial denture under the unit fixed partial denture. Contents of this presentation will be introduction, anatomy of periodontium, diseases of periodontium, periodontal care and prognosis. I'll be talking about the gingival biotypes that are available. I'll be talking about what biologic width is, signs of biologic width violation, and how to correct a violated biologic width in a particular patient. And I'll also be talking about preparation for periodontally weak abutment teeth and then periodontal procedures. Under periodontal procedures, I'll be talking about root resection, I'll be talking about emisection, I'll be talking about ridge augmentation and splinting, and finally I'll conclude with references. So introduction, the periodontal considerations in FPD is nothing but we are reviewing the process of periodontal diagnosis and the treatments that we render based on the periodontal health of certain individuals. So this is again a part of a comprehensive treatment. So you have to keep in mind that you have to always think about the periodontium when you are rehabilitating a patient. So your fixed prosthodontic treatment should always involve both your health of your periodontium, that is your gingiva, and the periodontal ligament. So all this together will help you in achieving a successful prosthodontic treatment. So always keep in mind, friends. So this is the most important basics, because whatever restoration you are going to give is going to be there in the patient's mouth for a very long period of time, and you do not want to harm the underlying natural tissues such as gingiva and the periodontium and as well as the alveolar bone. So this is an extremely important topic that whenever you are planning to give a fixed partial denture, please keep this in mind. So I'll do my extreme best to cover everything in this presentation. So let's move on to anatomy of periodontium. So in this picture you can see there is a teeth and there are certain layers that I have marked. Before we move on to that, so we have to know what are the linings of our oral cavity. So our oral cavity lining can have three different types of mucosas. So one is your masticatory mucosa, other one is your lining mucosa, and your specialized mucosa. So your masticatory mucosa is the lining of your gingiva and your hard palate. Your lining mucosa is the lining of your cheeks, your lips, etc. And your specialized mucosa is the one that covers your dorsal surface of your tongue. So please keep this in mind. This is the basic anatomy of your oral cavity. This is your basic linings of your oral cavity. And so now we move on to the gingiva. So gingiva is divided into three important categories. So one is your marginal gingiva, second one is your attached gingiva, and third one is your interdental papilla. So please look into this picture very carefully. So your MG refers to your marginal gingiva. So this portion, okay, where it has been marked MG refers to your marginal gingiva, and then this FGG represents free gingival groove. So this is your free gingival groove. So this is again another cross section view of your gingiva and your periodontal ligament along with your alveolar bone. And AG refers to your attached gingiva. So this entire surface from this to this is your attached gingiva, and this MGJ is your mucogingival junction. So this is your mucogingival junction, and AM refers to your attached mucosa. So always please keep in your mind that these are the most important anatomical structures of your gingiva. Okay, these are the different categories of your gingiva or different types of gingiva what each and every individual has. This is going to be same for everyone. So you have to maintain the gingiva and the periodontium of a patient. So if you give an over extended or an over contoured restorations, then the gingiva will get affected. So there will be some inflammatory processes, and then this will lead to your loss of bone leading to periodontitis, and finally the tooth will start shaking and it will fall off. So please keep in mind that these are the most important types of your gingiva. So you have your marginal gingiva, your attached gingiva, and your internal papilla. So you can say that these are the parts of your gingiva. So we saw about gingiva. So now let's see about periodontium. So basically periodontium is the connective tissue that anchors the teeth in maxillary and mandibular alveolar process. So this is a cross-sectional picture of your periodontium. So here you see this is a tooth and this is your periodontal unit, okay, and this refers to CEJ refers to cemento enamel junction, and PDL refers to periodontal ligament, B refers to bone, and C refers to cementum. So this is your cross section of how a periodontal unit looks like for each and every tooth. So periodontium is the connective tissue that anchors the teeth in maxillary and mandibular alveolar process. So this becomes easy if you see this picture. So this is extremely easy if you see this picture. So you can see this very carefully. You have a tooth and your tooth is being anchored to this bone with help of these fibers. So you have your tooth and this is getting attached with help of these fibers, so that you easily understand. I'm trying to repeat the same sentences such that it becomes easy for you.